So how do you get more of the leads that you're generating for your dental sleep medicine practice to actually get in the chair for a consultation and moving forward with treatment? Now, what a lot of dentists do is they show them this, and this is the reason that you should show up to my office and move forward with treatment, is because this is amazing. This is not amazing. What is amazing is getting to sleep with your spouse in the same bedroom. What is amazing is giving a grandmother the opportunity to become a great grandmother. What is amazing is allowing a father to have the energy to be present for his family. When you're having conversations with leads, you need to make that patient feel like you understand, not only understand what they're struggling with and what their frustrations are, but that you know how it feels. They have to sense empathy from you. And you can figure out how to generate that in conversation. But this solution is not what's going to get people in the chair. What's going to get people in the chair is people. It's going to be the person having the conversation with that patient, and that patient needs to feel understood, and they need to feel like you genuinely care about the result. So stop focusing so much on the clinical solution and start focusing on the lifestyle results that the patient will experience as a result of that clinical solution.